Hi, I'm Bob Comator from the law firm of Levy, Phillips & Koenigsberg, and we're very pleased to have with us today Dr. Harvey Pass, the Chief of Thoracic Surgery at NYU Medical Center and a specialist in mesothelioma and lung cancer. I know you've been involved for many years now with research on mesothelioma. Why don't you tell everybody about some of the more recent developments that you've been involved in?
Well, everybody, the holy grail with mesothelioma now is to either define patient groups, how to find patients early, or to find patients who will respond to certain drugs, or to find patients who you know really shouldn't get operated on because their prognosis is different. So we've been very active in trying to figure out if somebody has an asbestos exposure, are they at risk, and will give us some signal in the blood that they're developing a mesothelioma. So we have a series of markers that we've looked at that are in the serum and the plasma of patients, some of which we've published, that look very promising. And we've actually validated some of those. One of those includes SMRP, which is the most common one, that now is available as a approved test in a reference laboratory. Osteopontin still is being looked at, and specifically in the plasma. And then there are other biomarkers that are coming out shortly that are even better, that have the chance of really discriminating between mesothelioma and other tumors, as well as finding the disease earlier in patients who are asbestos exposed. We feel that if you find the disease early, everything improves, that you'll be able to do less of an operation, that you'll have a greater bang for your buck if you give some sort of cytotoxic therapy.
So when you say early, you're really talking about well before any symptomology, because I know when it comes to people that I know who have mesothelioma, usually they don't know even to go to a doctor until they have the symptoms, and at that point already it may be getting to be too late.
That's right. I mean, the whole way to look at this is most people, as you know, present with some sort of pleural effusion. But that pleural effusion has been there a while. So if you have a marker or a series of markers that work in concert to say, this patient who has no symptoms that comes into your office, if you get this blood test and the blood test says this patient has an effusion and the patient doesn't even know it, then that would be the first thing to say, hey, we need to get a chest x-ray to at least document whether there's an effusion. And if there's an effusion, then there's a series of markers that you could look at to even see whether that effusion is meso or not. But the presence of an effusion in an asbestos-exposed individual is a real cautionary sign. So that would mitigate a workup.
And that really sounds like it's really not even all that invasive to be doing.
Absolutely. I mean, that's the whole point. You need to do something that's going to be cost-effective as well as minimally invasive. A CT scan is not that cost-effective, and also it hasn't proved to be the way to go in meso. In lung cancer, yes, at this point, but not in meso. And you want to make it so that it's easy for the patient. The patient gets a blood test, or maybe even gets like a diabetic test, so it's a real small pinprick, and you can do multiple markers on it. That's what we're trying to do with these markers.